everyone. I'm Alana and I am chair on today's podcast. We're very lucky to be doing another episode of the Prime podcast series. And on today's episode, we have two great speakers with us. We have Baxter Chirambo and Elwin Shawa. So I'll just get you, Elwin, to start off if you would give us a brief introduction about your research area and your background and where you're from.
My name is Elwin Shawa, a senior lecturer in nursing. I teach at Mzuzu University. I have masters in medical surgical nursing. I did it at the University of Nairobi in Kenya. My teaching experience is about 7 years now. I've been teaching at the university for 7 years. My research interest is NCD, non-communicable diseases. Like cancer is one of them in Malawi, and the hypertension, diabetes. So my research area is in non-communicable diseases. So I also teach oncology nursing. I teach
Wonderful.
The upgrading and the generic groups. Thank you.
Perfect. And Baxter, if you would do the same, just introduce yourselves.
Hello everyone, my name is Baxter Chirambo. I work with Mzuzu University. I'm a senior lecturer in Mzuzu University as well as the head of department for the nursing and midwifery. Apart from working with Mzuzu University, I'm also coordinating the Malawi EF Research Center, which is housed within Mzuzu University. So I do conduct research and I'm more in electronic health and in mental health. Thank you.
Perfect. So obviously this podcast is about cervical cancer, so we'll get straight into it. So I'll just start off by giving the definition for our listeners. So cervical cancer is a type of cancer that occurs in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. And cervical cancer is actually the fourth most common cancer in women worldwide. And according to the World Health Organization, in 2018, there were actually an estimated 570,000 women who were diagnosed with this type of cancer worldwide. And shockingly, there's 311,000 women who actually died from this disease. And it's one of the most preventable and treatable cancers. So we'll get straight into the first question. So for our listeners, we'd like to know what are the risk factors for cervical cancer development. Elwin, if you'd like to start off by answering this question.
Yeah, there are risk factors for cervical cancer development, like early sexual activity before 20 years, that is for women. If they start sexual activity before 20 years, they're at risk of developing cervical cancer because the cervix is still tender, so it's at risk for injuries and also infection with the HPV, which is human papillomavirus. It's also a risk factor. If you have a history of infection of HPV, you are likely to suffer from cervical cancer. The other one is having multiple sexual partners. If you are a woman, you're having multiple sexual partners, you can also suffer from cervical cancer. Or if you're married to a man who is having multiple partners, a woman is also at risk. The other risk factor is the immunosuppression. So immunosuppression, like the HIV infection, because HIV virus reduces immunity in the body, and also a person who is also taking corticosteroids, because this one, they also reduce immunity in the body. They're also at risk. Smoking is also a risk factor. So these are some of the risk factors for cervical cancer.
Wonderful, thank you. And Baxter, do you agree or do you have anything else to add?
Well, I do agree with what my colleague Elwin has said. However, I'm just going to add some few points to say that if someone is exposed to some other miscarriage prevention drugs, sometimes they are also at risk of having a cervical cancer. And as Elwin said, having multiple partners, it's one of the major risk factors. But at the same time, you might not have multiple partners, but then your partner is having multiple partners, where if they go out, they can be infected with the human papillomavirus, and then they can bring it over to you, and then in the end, a woman suffers from cervical cancer. So basically, that's that. Thank you.
Thank you. Yeah, I think the most important that you pointed out is the human papillomavirus, which accounts for greater than, I think, 99% of cervical cancer cases. So it's very important to mention that. And I suppose the next question we would have is, are there any symptoms that are quite obvious when you have cervical cancer, either early on or more in the advanced stages? Elwin, again, if you want to start us off with this question.
Yeah, generally, during the early stages, cervical cancer has no symptoms. But when it reaches in advanced stages, a woman might experience some symptoms like vaginal bleeding, experiencing pain when you're having sexual intercourse. Some, they have discharges. When there is infection, the discharge might be offensive and smelly. Some them might be experiencing some pain. Some, because if there is metastasis, like if it goes to the colon, they might experience some constipation because of the tumors in the colon. Some might lose weight because of the cervical cancer, because now it is chronic. Some, because if it is bleeding, they might have anemia, such problems. Thank you.
Thank you. And Baxter, we'll just go back to you again on symptoms of cervical cancer.
Just as Elwin has said, in the early stages of cervical cancer, a woman would not show any symptoms, as my colleague has said. But when it's in the advanced stage, that's the time when someone might might start showing the symptoms, as my colleague said, vaginal bleeding. And sometimes there might also be some bleeding. A woman might experience the vaginal bleeding even after menopause. You know, after menopause, we don't expect some vaginal bleeding from a woman. But then in this case, because of cervical cancer, a woman might show vaginal bleeding. Also, the vaginal discharge of someone who is having cervical cancer is having a false smell. So normally we don't expect a false smell from a vaginal discharge, but then with someone who is having cervical cancer, it comes out false smelling. And to some other women, they might also experience pelvic pain. So that pelvic pain sometimes can also show cervical cancer. Thank you.
So as we mentioned, obviously HPV, the human papillomavirus, is one of the most important elements in cervical cancer development. So we just want to inform our listeners and touch on it a bit more, just about what it is and its transmission, and perhaps how HPV and cervical cancer can be prevented through perhaps maybe vaccination programs or screening that is in place. So Elwin, we'll go back to you again.
Okay, on the prevention of cervical cancer. As you have already said, that HPV is the most prevalent that causes cervical cancer. And first we need to identify the types, because there are so many types of HPV. The most serious one is type 16, 18, 31, 33, and 45. So with these, and we know that the HPV is spread through sexually transmitted virus. So if with the coming of the vaccine, because the vaccine is administered to young girls from 9 up to 15 years, so that to prevent them from developing cervical cancer. And with the screening, for example, using the pap smear, and here in Malawi we use what we call VIA, which is a visual inspection using acetic acid. They screen the women to see the precancerous lesions, and if they are there, they treat it so that to stop from developing cervical cancer. Thank you.
Perfect. And Baxter, again, if you could just tell our listeners a bit more about HPV, its transmission, and any screening programs that are in place.
Yeah, so as we're talking about cervical cancer, we are looking at HPV as the main cause of cervical cancer. Now, this HPV, what happens is that when someone gets HPV, HPV in general, just say that it disturbs the cells in a woman. So the cervical cells are being disturbed. As such, if cells are disturbed in their growth, mutation can take place. So after a mutation has taken place, a lady would develop cervical cancer. So in this case, when we're looking at cervical cancer and HPV, in the onset, as my colleague said, you cannot know that someone is having cervical cancer because there won't be any symptoms unless if someone or a lady goes for visual inspection with acetic acid, that's VIA, and after that, then the cells are going to be seen to not to be in good shape, and then cervical cancer might be detected. So HPV is said to be the main cause of cervical cancer, and the prevention, generally, it means someone has to be off being in contact with HPV virus. Yeah, I think that's what I can say.
Yeah, both of you have touched on some really good points. I think it's important to know as well that HPV can actually cause other cancers such as vulva, vagina, anal cancer as well. So it's obviously, a very life-threatening virus if it's gone undiagnosed. And also that's why, as you mentioned, it's really important to get vaccinated. And I think it's great for our listeners to know that the HPV vaccine, it's safe and it's effective. And as you said, there are numerous programs available for preteens to get it. I was wondering, would we be able to, I suppose, expand on some other potential ways it's detected other than the smear test? I'm not sure if you know any, but Elwin, do you know any other ways that cervical cancer can be screened?
Of course, here in Malawi, we use the visual inspection using acetic acid, which is cheaper and not expensive, and is faster to see the results compared with the pap smear. Because pap smear, you take the cells of the cervix and you send them to laboratory. So it might take about 1 week to see the results. So because we use the local vinegar, which is found in our shops, it's not expensive. It will just need the vinegar and the lamp and the speculum and the antiseptic fluid and cotton. Then you are done. So we prefer this one because it's cheaper and it's economical to our women.
Very good. Baxter, do you agree with everything that was said?
Yes, I do agree with what Elwin has said. Having a lot of clients who need screening, the best resource is what is cheap. And in this case, using vinegar is one of the ways on how we screen women with cervical cancer here in Malawi. So we're using one of the cheap ways of screening cervical cancer. But whatever my colleague has said, I do agree with him. Thank you.
Yeah, that's really great. Thank you. And obviously there's some other tests just in case the cancer had spread. Usually X-rays or CT scans are there just to determine if it's gone into lymph nodes. I know some countries as well offer DNA tests. which scrape cells again from the cervix to identify the types of HPV that are likely to lead to cervical cancer in that patient. But it's great, obviously, that in Malawi there's a free alternative with the vinegar. I think it's a great idea and obviously accessible as well. So once the cancer is obviously diagnosed, there's biopsies, which include sharp tools to pinch off a small bit of the tissue samples within the cervical tissue. So that's just another method as well of detecting the cancer. So that leads us on then to the next question, which is, does this cancer progress quickly, or is it more of a slow development? And again, we'll start with you.
Yeah, the cervical cancer is a slow progressing disease. Usually, it might take 10 to 20 years for a person to start experiencing the manifestations. So it's a slow progressing disease. Of course, very few, it might progress faster, but most of them, it progresses slowly.
Perfect, thank you. We'll just go then to the next question. That was a nice one. So the next one is, I suppose, it's sort of a big area. It's what are the treatment options? Baxter, if you want to start us off with any treatment options you know for cervical cancer.
Well, the treatment option, which is mainly done here in Malawi, when a woman has been diagnosed as having cervical cancer, is to remove the uterus. So that's what happens here in Malawi. So a woman is undergoes a surgical procedure where they remove the uterus. That's total hysterectomy. And in that case, that helps the woman from having progression of cervical cancer to metastasis to other body parts. Yeah.
Perfect. Thank you, Baxter. And Elwin, what would you say are the current treatment options available?
The current treatment available worldwide, I'll start with the worldwide. That we have surgery, as Dr. Chirambo said. We also have chemotherapy. We have radiotherapy. So here in Malawi, it will depend on the stage of the cervical cancer. If it is during the what we call precancerous lesion, for example, after doing the VIA and it is positive, what they do, what we call cryotherapy, they freeze the cells that they suggest that there is abnormal cells. So they freeze those cells and they die. In such way, they're trying to kill those abnormal cells to prevent the progression of the cancer. If the cancer is advanced, that it is only confined to the cervix, then the surgery can be done. They can do the total hysterectomy, remove the uterus and the part of the cervix, so that the abnormal cell, the cancerous tissue is removed. The other one is chemotherapy. Chemotherapy, it is given if it is surgery cannot be done. So in this case, the main goal is not treatment or curative, but is palliative, to lessen the symptoms of the patient so that she has improved quality of life. But radiotherapy in Malawi, we don't do radiotherapy. If they would need for radiotherapy, then they refer to other countries to receive the radiotherapy. Thank you.
Thank you. Yeah, you've touched on some really good points. And I think one is obviously that the treatment depends on how large the cancer is and how far it has spread. And that's why it can be quite a complex treatment process. In Ireland, we're quite lucky. We do have multidisciplinary teams to treat it. So there's, a big involvement, which is really important because there's so many treatment options. You've touched on a good few there, such as radiotherapy during early stages or surgery, chemotherapy, and radiotherapy again for advanced stages. And there's different surgeries. So there's the hysterectomy, which is where the cervix and the womb are removed. And sometimes they also remove the ovaries. See, a lot of women then would be wondering about their ability to have children, and that will depend on the surgery you have. I know in Ireland there is one type that's offered. It's called trachelectomy, and that's where it's the cervix and surrounding tissue and upper part of the vagina that's removed, but the womb is actually left in place. Advantage that you still have your womb to carry children, so it's still possible. It might be more difficult, but it is a possibility. And obviously that's not the case then with a hysterectomy or pelvic exenteration, which is removing many different parts, including it could be even so far as the rectum or the bladder. What does the future look like for those diagnosed with cervical cancer?
So many research is being done and so many programs that are there targeting prevention of development of cancer in men and women. And we encourage women to seek health services area before the cancer is advanced. So, and also awareness to the community is very important, because if many people they have knowledge and they're aware of the implication of cervical cancer, that means many people will start seeking screening services earlier. And if it is discovered earlier, that means it will be treated, it will be cured. So it is promising. We can beat the cervical cancer.
That's great. Thank you, Elwin. And Baxter, do you have any concluding remarks or comments?
Just as Elwin has said, maybe I can just add before I make my concluding remarks to say that there's really a hope in the sense that there's a lot of campaign which is being done, more especially here in Malawi, where young girls are being encouraged to go for screening. So they have to undergo screening periodically, and then even women are encouraged to go for screening. So they're being taught. And in the event that someone feels that they're not okay, they're encouraged to go to the hospital as quickly as possible so that they can get treated. So treatment options are there. A woman gets treated before the cancer gets bad. And then in the event that possibly it has already gone in the advanced stage, treatment is also being given, like the surgery, which I mentioned before. So a lot of women are being encouraged to go to the hospital and seek medical attention so that they can get better and be free from cervical cancer. But apart from that, women are also, and young girls are also encouraged not to have multiple sexual partners, and the girls are also encouraged not to have early sexual intercourse, because that is one of the risk factors for them to have HPV, which can later lead to them having a cervical cancer. So basically, my concluding remarks, my concluding remarks would be: girls out there, there's hope. Those of you who have not yet gone for test, can you go for test? And then you get tested for cervical cancer. In the event that you are found with it, you get treatment as soon as possible. And in the event that you don't have it, practice safe sex or abstain until such a time that maybe you're old enough to go into marriage, and then that's when first of all you go for testing and the like, and then you prevent yourself from having cervical cancer. Basically, that's what I can say. Thank you.
Thank you, Baxter. Yes, so hopefully with the HPV vaccination and screening out there, that the cancer incidence will begin to decrease. Currently, it's estimated that one life is lost every 2 minutes to the disease, which is quite stark and surprising. But hopefully, due to it being a very preventable and treatable cancer, that hopefully, there is a positive outlook, as long as you say people put themselves forward to practice safe sex, and also, go for their screening and do take up the vaccination if it is offered. So I suppose that is all for this podcast series, unless anyone has anything else to add. We will leave it there, and it's been a great discussion, and hopefully our listeners will really learn from it.